Hi everyone. Today we are going to discuss about scrub typhus, a very important topic for NEET as well as the Central Institute exams. Now, scrub typhus is one of the rickettsial diseases caused by Orientia susu-gamushi. Now, this is the causative organism. Let us first dissect its name. Orientia is derived from Orient, meaning east. The eastern part of the globe is affected more commonly, and susu-gamushi is a Japanese term. Susuga means illness and mushi means insect. Okay, so like most of the rickettsial diseases, this disease also is vector borne. And who is the vector? Which is the vector? The vector is the trombiculid mite, but this vector per se is not the villain or the culprit. Who is the villain actually? The villains actually are the larval stages called as chiggers. Actually, the mite lays eggs first, and these eggs hatch out to produce larvae, and these larvae are referred to as chiggers. And the organism Orientia susu-gamushi is maintained by trans-ovarial transmission in these mites. Now, because chiggers are so very important, the disease scrub typhus is also known as chiggerosis. Now, this is how the organism looks like. This is an electron microscopic picture. It's a rod measuring 1.5 to 3 microns in length and 0.2 to 0.8 microns in width, looking somewhat globular. And just like other rickettsia, it's also an obligate intracellular organism, so it's an atypical bacterium. Now, this is how the chigger looks like. This is the adult, and again another picture of the larva, that is the chigger. Now, clinical features. Following an incubation period of 6 to 21 days, the onset of the disease is heralded by non-specific features like fever, cough, chills, myalgia, and the gastrointestinal symptoms like diarrhea, vomiting and all. The classical triad is the eschar, the regional lymphadenopathy, and the maculopapular rash, but it is not observed in all the patients. Eschar is appreciated in less than 50% of the patients only, and the rash is seen in less than 40% of the cases. Now, what does eschar actually mean? Eschar means a dry, dirty scab. It's a darkened region on the skin, and the etiology could be burns, or it can be due to insect mites, or it could be infective in etiology. For example, in this case, the scrub typhus, or the classical case of cutaneous anthrax caused by Bacillus anthracis. Now, in few cases, complications can also develop, such as encephalitis and interstitial pneumonia attributed to vasculitis. As we all know, a classical feature of all rickettsial diseases is rash. R for rickettsia, R for rash, because these bacteria have got a predilection to infect the vascular endothelial cells. So if nothing is done on time, the patient can lose life also because of the involvement of blood vessels, and the case fatality rate in untreated cases is 7%. Now, as far as scrub typhus is concerned, we should know about a tetrad known as the zoonotic tetrad, which includes the mites. Mites are obviously significant, and I've already spoken about it, especially the chiggers. Then small mammals like rodents, shrews, which are also infected by mites, but they are not the main reservoir for humans. The main reservoir are the mites for us. Then scrubby vegetation, which looks like this, bushy vegetation, which is a very supportive habitat for the mites, because it is in this vegetation environment that chiggers are produced. And lastly, wet season, that is rainy season, because chiggers are most commonly produced during wet season. Now, although scrubby vegetation is included in the tetrad, but desert regions, sandy and semi-arid regions can also be endemic if at all the vector is found to be present in these regions. Then, apart from the tetrad, another triangle associated with this disease is also important, known as the susu-gamushi triangle, which spans from northern Japan and far east Russia in the north to Pakistan in the west to northern Australia in the south. And the countries included in this triangle are India, Pakistan, the Pacific Islands, Afghanistan, New Guinea, and the tropical Australia. Okay. Then, as far as lab diagnosis is concerned, serology is the mainstay. The antibodies can be detected by ELISA and indirect immunofluorescence technique. Indirect immunofluorescence is the gold standard test. Now, culture is just a formality. It is usually not done because it is very time consuming, taking about 4 weeks. But if at all you want to cultivate the organism from the specimen, you can use the yolk sac of fertilized hen's egg, or you can do cell culture using Vero cells, MRC5 cells, etc. Now, another thing I would like to mention over here is yolk sac is also used for another bacteria known as Chlamydia, and the similarity between Rickettsia and Chlamydia is that both are atypical in the sense that they are obligate intracellular bacteria. Okay. Then molecular techniques are being tried, for example, PCR, nested PCR, and LAMP. And what exactly are the targets of these molecular techniques? They target certain specific genes, for example, a 56 kilodalton gene, a 47 kilodalton's gene, then the 16S ribosomal RNA gene, and another gene which is the 60 kilodalton heat shock protein gene. However, these are still in experimental stages and they are not available everywhere. Then last but not the least, Weil-Felix reaction, which is usually not done, but still questions are being asked on it. Now, Weil-Felix reaction is a heterophile agglutination test, which is based on the sharing of an alkali stable polysaccharide antigen between certain rickettsial species and certain non-motile strains of Proteus known as O cross 19, 2 and K. Please remember, it is not 0. O means the somatic antigen in the LPS, and it is followed by cross, and it's not X. This cross actually represents the absence of the flagellar antigen. Okay, so this is the list of diseases which can be diagnosed on Weil-Felix reaction. You can diagnose tick-borne spotted fever, in which case you will get agglutination with the O cross 19 and the O cross 2 strains. Remember, TBSF, tick-borne spotted fever, B for both the numbers 19 and 2. Then we have got the typhus fever, both epidemic and endemic typhus, in which case we will get agglutination only with the O cross 19 strain. Then the strep typhus, remember Shah Rukh Khan or Salman Khan, whoever you like most. S for scrub typhus, and K stands for the O cross K strain of the non-motile Proteus. Okay, so the very basis of the heterophile, hetero means different, phile means to love. So the very basis of a heterophile agglutination reaction is that certain antigens love to stay in different species. For example, this is the classical case. Okay, so Sneha Ulal over here can be looked upon as the non-motile Proteus strain, and Aishwarya Rai can be given the credit of bearing the antigen present on the rickettsial species. Okay, so the antibodies become confused, and that is why the antibodies which are produced in response to these rickettsial species, they produce agglutination when we make them meet with the non-motile strains of the Proteus. Now, the diseases which cannot be diagnosed on Weil-Felix reaction, this is another MCQ. Remember Bakra, Brill-Zinsser disease, Q fever, and rickettsial pox. Now, certain books say that Brill-Zinsser disease can be diagnosed on Weil-Felix reaction, because Brill-Zinsser disease is nothing but a reactivation infection of the epidemic typhus. Okay, point noted. But then Brill-Zinsser's is reactivation, so in many cases the antibody titer is much less, which is missed on a Weil-Felix reaction. So by all practical means, we'll consider that Brill-Zinsser cannot be diagnosed by Weil-Felix reaction. Then lastly, the treatment part. The drugs which we can use are doxycycline and chloramphenicol. Remember, we cannot use cell-wall-acting drugs because Orientia susugamushi is very different from other bacteria, since it does not have the lipopolysaccharide layer, and it does not have the peptidoglycan either. Okay, so that's in that respect it differs from the other rickettsial organisms. And people in Thailand, there were some cases of scrub typhus which showed response to rifampicin instead of doxycycline and chloramphenicol, and some degree of success has also been achieved with the use of azithromycin and clarithromycin. So this is in a nutshell about scrub typhus. For any queries, you can please write your queries in the comment section. Thank you.